Assalamu alaikum. I am Sana Amir and my roll number is PP1650198 and my group number is 52. The topic of my presentation is thyroid disorders and the subtopic is subclinical hyperthyroidism. First of all, I will give a brief introduction about the thyroid gland. The thyroid gland is located around the trachea and it has two lobes. The thyroid uses iodine to produce vital hormones such as thyroxine and triiodothyronine. Now here is the thyroid system. Basically the function of thyroid. That is, when there is low level of thyroid hormones in the body, the hypothalamus triggers thyrotropin releasing hormone which stimulates thyroid stimulating hormone that causes thyroid to release hormone T3 and T4, which helps in increased metabolism, growth and development, increased catecholamine effect. Then by a negative feedback mechanism to the anterior pituitary gland, the secretion of T3 and T4 is stopped. Thyroid function is regulated by the brain. Now here is some thyroid disorders. There are certain conditions or diseases which affect either the thyroid gland's structure or function that causes thyroid disorders. As the thyroid gland is controlled by the pituitary gland and hypothalamus, so the disorders of these tissues can also affect thyroid function and can cause thyroid problems. There are different kinds of thyroid disorders that includes hypothyroidism, hyperthyroidism, goiter, thyroid nodules, thyroid cancer. As my topic is subclinical hyperthyroidism, so I will discuss the hyperthyroidism. Hyperthyroidism is a condition of thyroid. Hyperthyroidism occurs when the thyroid makes too much thyroxine and triiodothyronine hormones. Diagnosis of overactive thyroid and treatment of underlying cause can relieve symptoms and prevent complications. Now here are different measures by which we can estimate that which thyroid disorder is present. First of all, we will measure the thyroid stimulating hormone level. If it is suppressed, then we will go for the measuring of free T4 level, and if it is normal, then we will measure total T3 level, and if it is also normal, then we will estimate that the disease is subclinical hyperthyroidism. In the same way, we can detect different thyroid diseases such as thyroiditis, exogenous hormone, 3C toxicosis, toxic multinodular goiter, and toxic adenoma. Now here I will discuss subclinical hyperthyroidism. What is subclinical hyperthyroidism? Basically, subclinical hyperthyroidism is defined by a low or undetectable serum thyroid stimulating hormone level with normal free thyroxine and total or free triiodothyronine levels. It can be caused by increased endogenous production of thyroid hormone, by administration of thyroid hormone to treat malignant thyroid disease, or by unintentional excessive replacement therapy. Case study. JC is a 68-year-old male who is found to have a TSH level of 0.25 microunits per ml. Normal range is 0.5 to 4.7 with normal FT4 and FT3 hormone levels on routine blood tests. He is otherwise healthy and denies any symptoms of thyroid dysfunction. On physical exam, his thyroid gland is normal. He denies any family history of thyroid disease and is taking no medications. How should these tests be interpreted? How should JC be managed? Now, the subjective of the case study is gender is male, age is 68 years old, history is no medical history. Objective is by the tests, it is found that patient have low level of thyroid stimulating hormone while normal levels of FT3 and FT4. By the diagnosis, it is estimated that patient has subclinical hyperthyroidism. Assessment is the patient is healthy. Treatment could be considered if there were concerns about cardiac disorder or bone loss. Otherwise, no therapy is reasonable based on the available evidence. As his thyroid function tests should be repeated, an RAI update and scan should be obtained to detect any hyperactive areas or nodules that might be responsible for the suppressed thyroid stimulating hormone. The plan is close monitoring of thyroid function tests is recommended every 6 months to a year. If hyperthyroid symptoms or changes in cardiac or bone function occur, then RAI therapy is recommended. Thank you.